Welcome back, everyone. We are here with Jim Shine, owner of Insure It Forward, joining us now. And you were here talking about this last week, but things that have actually changed since you were last here. There has been an executive order that could affect all of us, many Oklahomans for sure. What's going on here?
That's right. The first day in office, President Trump did an executive order basically saying that he wanted to eliminate any of the hardships associated with the Affordable Care Act, or Obamacare as most people know it. And it's kind of, we're not exactly sure what that means, but we do know that he wants to remove any financial hardships on individuals, corporations, hospitals, stuff of that nature. When I've done some research and really dug into it, most of the Affordable Care Act is legislative, and so he can't change a whole lot of it through executive order, but he can give his people the ability to interpret it. For example, if somebody doesn't buy health insurance because of a bankruptcy or something like that, they can apply for a hardship exemption. Well, this would give Tom Price, if he's confirmed, which we believe he is, the ability to broaden that somewhat, what a hardship exemption looks like. You still have to file for it, you still have to get approved, but it should create a little more leniency for the different parts of the administration.
Well, let's localize it. What does that mean for Oklahomans?
For Oklahomans, for the most part, I don't think it's going to mean a whole lot this year. There are going to be a few people that are going to qualify for a hardship exemption, but I really wouldn't bet on it because all the laws have already been passed. The insurance companies are, their contracts are all already set up for the year, so I really don't expect any changes for Oklahomans this year, other than a few people might get exemptions.
Well, but you may have not qualified for one before, and maybe you could now.
Right. You might qualify for an exemption now once they kind of define what that is. So those may loosen up here in the next couple of months a little bit.
But as you said, it is very confusing, and that is something you guys do, is help people through this.
Yes. What we try to do is help people find the right health insurance plan, and it is really confusing. We get a lot of people that call in and they say, well, I don't want Obamacare. Well, basically, if you have health insurance in Oklahoma that meets the requirements where you don't have the penalty, you have Obamacare in some form or fashion. For the most part, that's just Blue Cross and Blue Shield in Oklahoma for individuals. There are a couple exceptions, which I'll be getting into great detail on tomorrow. Like the Christian health share plans. Okay. They're not Obamacare, but they're an exemption to Obamacare. Then you also have some other plans out there, but for the most part, on health insurance, if it's not Blue Cross Blue Shield, there's probably something missing, some part of it missing. There's a lot of many medical plans out there, and what they do is they pay X amount per day in the hospital, and those type of plans you want to be leery of. If yours isn't a true major medical with Blue Cross and Blue Shield, if you haven't at least looked at one of those plans first, you really want to, because $1,000 a day might sound like a lot, but if you got a $100,000 bill, that's not really a whole lot of money.
Well, we still have time to, if people are not registered, they still have till the end of the month?
Yes, they still have till the end of January 31st, and we'll be working extended hours at both of our locations in Edmond and in Moore to help people get qualified and signed up for a plan. And a lot of people that have gone there before didn't qualify for subsidies maybe last year, and this year they've changed a lot. The premiums have gone way up, but so have the subsidies. So on my website or on my Facebook page, we went ahead and posted those guidelines, and a lot of people will qualify for basically no cost health insurance if their income is within those guidelines.
Still so many questions.
I know, riveting, and yet I just have a million questions. So that is exactly why Jim will be back with us with more expert advice. In fact, he'll be back tomorrow. But you don't have to wait. If you have a question, call Insure It Forward right now. The number is right there, 405-585-0648, or you can get on their website, insureitforward.com. Also, Facebook, Insure It Forward, and Twitter, @InsureItForward.